We have a great episode of Major Pain for you today with Tayler sharing her amazing story. Before we get to that, there's a couple things I wanted to chat with you about. Regular listeners will have noticed over the past couple months that my release schedule has changed significantly. First, I was gone for a month on my honeymoon, and since then, I've only been putting out an episode every other week instead of every week. This is because I have just been so incredibly busy. I am now working 2 jobs, which I'm thrilled to be able to say. I'm basically working full-time at this point, which for someone who, has a chronic illness and had to go on disability, that is such a huge victory. But I'm finding that I am reaching the limit of what I can accomplish in any given week, and I have just not been able to keep up with doing the show once a week. This is something that has been stressing me out. I've been talking to my therapist about it. Obviously, this show is deeply important to me, and I've put so much time and effort into it since it launched in 2021. We've built this incredible community, and it just means so much to me. So the idea of not providing the same level of consistency that I always have has been distressing to me. And my therapist had really good advice to me, which is that, I am someone with a chronic illness, and I'm hosting a chronic illness podcast, and it is of the utmost importance that I take care of myself and I not push myself too hard. And I show a good example for someone with a chronic illness trying to balance work and life and creative projects, and that I not burn myself out. So for the time being, I'm going to attempt to continue to put the show out every other week. And while I'm doing that, I am working behind the scenes on trying to grow the team that makes the podcast. Because right now the team is just me, and it is a lot to do by myself. When I was not working because of my chronic illness, it was something that gave my life so much purpose, and I did all of that work with so much joy. And now that I'm working full time, I just don't have the spoons. So I need help. I have talked to a couple people about this, and I am moving forward with trying to figure out how to transition some of the work to other people. If you are interested in working on this podcast, please reach out to me. No transition of the work has yet occurred, and the more help I can get, the better. So if you have any content creation skills, social media skills, website building skills, anything at all that's involved in making a podcast, and you have a passion for chronic illness and disability advocacy, please reach out to me, majorpainpodcast@gmail.com. My goal is to hand off as much of the work as possible without affecting the quality of the show. Conducting the interviews is the thing that I love the most. It's the thing that I really want to hold on to. But everything else about producing the podcast, I'm willing to let go of and work with other people to do. I will do everything in my power to keep this podcast going as long as possible. It is one of my favorite things that I've ever done and continues to be so. I'm also working behind the scenes on the Undiagnosed Disease Fund, which is so exciting. We are giving away genetic testing to 3 people. 2 of the 3 people have been officially chosen, and I am interviewing a 3rd soon. And I've been in discussions with a genetic testing company. It's actually Genome Medical, which is the company that did my genetic testing, and I had a great experience with them. And they are very interested in working with us on this, which is very exciting. So that's something else that I am working on behind the scenes, on top of my 2 jobs, which if you're interested, you can follow along with what I'm creating for my other 2 jobs. I am the social media manager for the Majestic Bay Theaters here in Seattle. We have started doing retro nights where I am hosting community votes where people are picking films for us to show on the big screen. We've done 2001, The Wizard of Oz. We're about to do E.T., and the next one coming up is going to be Hook, which I'm so excited about. And I'm also the community manager for Cosmodio Instruments, an effects pedal company founded by one of my best friends. So I'm creating music content and demoing how these pedals work, and both of these are just absolute dream jobs for me. And the fact that I am physically well enough to do them is such a gift. I want to do everything. I'm trying so hard to do everything, and I'm recognizing that I'm coming right up to the limits of what I can do. I love everything that I'm doing right now so much, and I just want to do it all, and I'm working really hard to find the balance with the full knowledge that I have this chronic illness, and even though I am in a stretch of wellness, I am pushing up to this limit where I am starting to feel the effects of doing too much, and with mast cell activation syndrome, that is a dangerous combination. So thank you for your patience as I work through this and figure out what that balance is going to look like. Thank you so much. Extra special thank you to all the Patreon community who is still supporting this podcast. I am so sorry that I have been less consistent than usual. We are way behind on bonus episodes at this point for a variety of reasons. Beyond what I just discussed, I also got sick and have been out of commission for a little while. But we will catch up on bonus episodes. We haven't yet recorded the bonus episode about our honeymoon, which Andy and I are still so excited to do. And now that I'm through my illness, we can get back into the same room together to record. And while I'm looking to bring in some other people to the Major Pain team, the support of Patreon is going to be the fuel that can make that possible. I really want to be able to financially compensate people who work on the podcast, and I want that to be people from within the chronic illness and disability community. My dream vision for how this could work is that the Patreon could continue to fuel the podcast, but not just to support me, but to support other creators as well, all of us working as a team on creating this show. That's what I'm striving for right now. We'll see if I can make it happen. There's a lot of moving pieces, and I've come to quickly realize that handing off any piece of creating this show is a lot more difficult than I'd hoped it would be, but I have a lot of hope that I can make it happen. So that's what I'm shooting for. And while we're talking about the Patreon, thank you so much to our Patreon producers who are supporting this show at the highest tier of $25 per month, which is so incredibly appreciated. Steve Kavanaugh, Trish O'Brien, Chris Fowler, and Hipster Leia. If you're interested in joining the Patreon to help this show continue, now is an excellent time to do so. You can learn more at patreon.com/majorpainpodcast. There are other great ways to support this podcast. Rare Patient Voice, an excellent program that connects you with research studies and surveys where you can be paid for your time to share your experience living with your diagnosis, and it can be any diagnosis at all. Our ongoing partnership with NeuroHealth, an online neurology clinic where you can get the help that you deserve without having to wait for months and months and months for an appointment. They deal with most neurological issues and much more. And of course, our Amazon shop. If you're doing any shopping on Amazon, you can start that shopping trip from our Amazon shop and support this podcast no matter what you buy. And you can also take a look at the shopping list that I've put together of my MCAS supplements and other things that make my life easier with the chronic illness. All of those links are in the show notes of this episode. And the last thing I'll say as we jump into our fantastic episode with Tayler today is that I am not a medical professional. Please do not take any medical action based off what you hear on this podcast without first consulting your doctor.
How lucky it is just to get through a day without pain.
If you look at me, it doesn't appear that I have a disability.
A test that comes back abnormal, it's like, yes, we're onto something here.
Welcome to Major Pain. I'm your host, Jesse Mercury, and this week I'm so excited to be joined by my guest, Tayler. Tayler, welcome to the show.
Hi, Jesse. Thank you for having me.
Yes, I'm so excited to talk to you. I also want to thank you publicly for your flexibility. My scheduling in the last couple months with my wedding and honeymoon has been all over the place, and I've been slow to respond to things and having to reschedule things, and you've just been very flexible, and I appreciate it, and makes me extra excited to finally be able to meet you and talk to you today.
Yeah, it's super exciting. And, real life, sometimes it just takes its own reins and you just got to go with it. So completely understand.
Yeah, absolutely. I definitely am on a ride recently, and it's all been great stuff. It's just everything happening at once.
Totally.
Okay, well, I'm so excited to hear your story today. Before we get into that, I'd love to get to know you a little bit. So Tayler, why don't you tell us about yourself?
So my name's Tayler. My pronouns are she, her. I am a thin, young, white woman with kind of short brown hair. I am in my mid-20s and I live in Oregon. I am married to my husband a year and a half now, but we were high school sweethearts, and
Aww.
2 dogs. We have a Chihuahua and a pug. I do a lot of things. I wear a lot of hats. I'm a professional photographer. I've done that for many years now. I mostly do weddings and couples, which is super fun, but recently been doing more branding photography. I own my own small business making ostomy bag covers. I work in healthcare because I want to go to PA school eventually, but I graduated with a degree in sign language. So I'm also a sign language interpreter, and I mostly do deaf-blind interpreting, actually, which is tactile sign language. So I love doing all those things. And then on top of that, also do disability advocacy online, but also in person. So I do a lot of work with the community in Portland, Oregon, which is super great. And I've met a lot of cool people around there too. So lots of fun things, a lot of different areas, but I love all of it. So
yeah, amazing. I mean, you sure do wear a lot of hats, and those are all incredible things. My my dad is a retired professional photographer, so I grew up around that environment.
Yeah.
I have taken some sign language classes, although I've forgotten most of it.
Yeah.
I'm not good at languages, unfortunately. I wish I were.
I'm not good at any languages that aren't sign language. So
Yeah. But I have a little bit of experience enough to know that sign language is an incredible language and so expressive and so beautiful. So yeah, I mean, amazing. Sounds like you're involved in so much cool stuff. And the ostomy bag covers too. I've seen that online. It's so cool. I'm sure we'll, get into more of that as we talk through your story today. Yeah, well, I'm very excited to hear all about what you've lived through. So let's get into it. Tayler, what is your major pain?
my major pain, I consider EDS to be my major pain, Ehlers-Danlos Syndrome. And that major pain has caused a lot of minor pains that aren't so minor. So yeah, it kind of just started with EDS. Well, I use that lightly, started with EDS. That's the main culprit, but I was diagnosed with it kind of in the middle of the rest of everything going on. So that's my major pain.
Yeah, and let's remind people, what is EDS, Ehlers-Danlos Syndrome?
Ehlers-Danlos syndrome is a connective tissue disorder. There are 13, 14 subtypes. Not sure the research if they've officially confirmed the 14th type. But I have the hypermobile type. That's the only type that does not have a current genetic marker. So you can't like go get a blood test for it. And so it's based off of clinical diagnosis. And I originally, didn't have great access to quality health care growing up. And so that's why it took me a little bit to get diagnosed with it. But I am just textbook EDS, connective tissue disorder. I have, all of the laxity, joint issues and collagen defects. So yeah.
Yeah, and EDS, presents so differently in each person and comes with so many comorbidities. And it sounds like you have a handful of those as well. And I'm so interested by what you said about how you were diagnosed with EDS in the middle of your journey. So it sounds like maybe the comorbidities were what the doctors were looking at first, and then things kind of went out of order as far as figuring out what was happening. So when did this start for you? How old were you when you started noticing symptoms?
Birth. I was born with congenital muscular torticollis. So that's like I have a crooked head. My parents didn't put me in a helmet. So I was like one of those babies with crooked heads, and my parents didn't, go the helmet route. So I still have a crooked head. Can't wear headbands. They slip off on one side. It's, sad, but
this is completely new to me. Tell me the name of that disease again.
Congenital muscular torticollis. So
a crooked head. What does that mean? How does that manifest?
Well, so it manifests like my skull is just misshapen. It causes kind of muscular asymmetry in like the neck shoulder area. So like if I turn my head this way, this muscle is fine. If I turn it this way, I have like short tendons like in my neck and my muscles and stuff. And if you're watching, I guess the video, it caused scoliosis for me too. So my shoulders are uneven and my neck is kind of like off center from the rest of the alignment of my body. So that was one of the first things that was noticed. I was also born with club foot, which is associated with EDS as well. And I had some GI issues that were a lot more mild when I was a child and then got worse as I got older. But that was present at my birth. I started growing up and I was kind of like a, awkward, lanky. I mean, what kids aren't awkward and kind of lanky and, uncoordinated, but looking back, it was a little bit more prevalent in me, like especially compared to my sister. And I started complaining of pain really early on, like joint pain, body pain, wasn't able to keep up with my peers. And so that resulted in, my parents would take me to doctors and they're just like, oh, it's just the way that she is, she just needs to like stretch more or whatever. But I got septic arthritis when I was 4, and that was the next big thing.
Wow. Septic arthritis. I've never heard of that either.
Yeah. So it's like I had like systemic sepsis, but it can also manifest in septic arthritis where it settles in a specific joint. And so for me, it settled in my hip, which is actually like usually it settles in like shoulders or knees. But for me, it was in my hip. And so I got super sick and lived in rural Idaho. And so my parents took me, to the hospital, and the nearest doctor that was like trained, I guess, to like do this surgery that I needed was 2 hours away. And I was like so close to death that they were like, we don't have time to get this doctor down here. So my parents had to sign a consent, basically giving like a podiatrist, like a foot surgeon, permission to do this surgery for the first time ever. But otherwise, like the other option was like I just die because I was so sick. So
Wow.
that was like the next big thing that happened. Yeah.
And am I remembering sepsis correctly, that often happens when there's like a leak into the bloodstream of something toxic?
Yeah, like an infection, basically. It's like a systemic infection that your body just can't fight. Yeah.
Oh, wow. Okay. Yeah.
Oh.
I'm like vaguely remembering sepsis in an earlier episode, very different situation. So do you have any idea what caused this infection that led to sepsis?
At the time, they said that I probably just had like a mild case of strep throat that somehow like turned septic. My parents don't
Wow.
really remember me being like sick or like having a cold or having strep, but I did get strep pretty frequently as a kid. And I just 2 years ago finally went to an immunologist to be like, why am I getting sick all the time? I seem to catch everything. Like I can't go 2 months without getting sick. And they tested my like immune system basically, and I was just deficient. Like I had all these deficiencies in like my immune system where your body should have naturally built up these defenses, these antibodies, and I didn't for some reason. And so I had to go through like a series of vaccines to basically like give my body the antibodies that it needed. And so since then, I've actually gotten sick way less. I'm not catching everything all of the time. So it was probably just an immune deficiency issue that they didn't care to investigate when I was younger.
Yeah, and they just blame it on strep throat. I think often doctors will want to give, their patients some form of solace by having some explanation. And they'll say things like, oh, this was caused by that, when it's like, maybe this is what happened. Like, this is a plausible explanation that I can think of. But instead of framing it like that, they tell you that it is what happened. And then you kind of move forward as the individual patient with that knowledge in your head of, oh, this is what happened to me, when it isn't necessarily the truth.
Right.
Which, it's just one of those little things to keep in mind as you're advocating for yourself out in the big, wide, scary world out there. Did you say you were 4 when this?
I was 4, yeah. I was 4.
Okay. My first memories of life are when I was 4.
Yeah.
So what do you remember of this time?
I remember, I've told my parents that I remember going into the OR and it being like the classic, like white, sterile, scary, cold OR. I don't know if that's my actual memory or if that's maybe what I was told happened, because I was really, really sick. So it's kind of surprising that I would remember anything for a really long time. But it happened really fast. I remember my mom was taking me to dance class and I fell getting out of the car because I couldn't stand on my leg that was being affected. And then by the time she got me home, I had a 104-degree fever. And I don't really remember anything after that except just crying in excruciating pain when my dad had to pick me up to carry me into the hospital because it was just like so painful. And then the memory of the OR, I don't know if that's like a real memory or not, but then after that I was in the hospital for weeks, and the nurses would always, when they would come give me my antibiotics, they would always put a sticker on my forehead. And so I remember having a sticker on my forehead, and then I couldn't walk because I had surgery on my hip, and so my mom would pull me down to the cafeteria in a little red wagon, and I would go eat just their bacon, only their bacon. So those are my memories that I have from that. So
Wow.
they're not obviously good memories, but at least it's not like, I remember being held down and like all these horrible things happening. Like they definitely tried to make it less scary, as much as they could.
Yeah, but also just interesting as a human in your mid-20s that your formative memories, earliest memories are of illness.
Yeah, for
That
sure.
really shapes your life.
Yeah.
My earliest memory I just have to share this story while we're talking about it. When I was 4, I started feeling like I was remembering things for the first time. It's like I start imprinting memories. And then by the time I was done being 4, because it's the first thing that I really had clear memories of, I started telling everyone, like, how old are you? I was like, oh, I'm 4. I've been 4 for a long time. And that's what I remember, is just telling people that, like going to get a haircut. I think it was my first haircut outside of the house. And like, how old are you? I was like, yeah, I'm 4. I've been 4 for a really long time.
Yeah.
Because
Well,
it's the
time
first
goes
time in
fast
life.
the older you get. So you really were understanding the concept of time in that moment.
It's my first experience with the concept of time, because I think before that, memories were just in and out and just weren't really sticking. And when they started to stick, my concept of self started and then continued throughout that 4th year of life, and it seemed like it took forever.
I feel like that's actually such like a rare conscious thing to be able to grasp at that age. Like I feel like most 4-year-olds wouldn't like be able to like grasp, the basically perception you had of yourself and like your timeline.
Yeah, I don't know. I mean, yeah, it's an interesting thought. Just thinking about how brains form and when you start to create memories and all that. It's very interesting stuff. So you said, okay, you had this surgery on your hip, and is that because that's the joint that was most affected by sepsis? And what did they have to do in surgery to try to help fix that?
Yeah, so that was where the sepsis had like settled in my body. It should have been a laparoscopic, pretty easy procedure to just drain the infection. I basically just had like a pocket of infection in my hip joint. But because it was done by a doctor who had never done the surgery before, he like sliced my hip like completely open. So on my little teeny tiny body, I had like a big scar across my entire, hip. Now as I've gotten older, it's gotten smaller, obviously, compared to my body. But they went in there and they had to drain my hip. They had to like wash it out. They had to like clean up. There was like damage done to like some of the muscles and tissue and stuff. So they had to like clean all that up. So that was like the initial surgery. And then after that, it was just like antibiotics and like clearing the actual infection that was still in my bloodstream. And then even after I was out of the hospital, I had like central lines and stuff at home, and a nurse came to my house 3 times a day to like do my antibiotics and everything for weeks after that.
Yeah.
I have like home videos going back to preschool, and like the teacher had to like explain to the students like they have to be careful with me and they can't touch my lines that I had, and I had to sit in a chair because I couldn't sit crisscross on the carpet, like stuff like that. So yeah. That was.
And so, I mean, from a very early age, you're having medical things happen to you that sort of make you different from the people around you. Is that something you remember experiencing?
Oh, definitely. And that experience, I think I obviously knew it wasn't my fault. It was like something that we could pinpoint as like an infection that happened to me I had no control over. But then all of my health issues after that had a different feeling like it was my fault, because it wasn't like an acute infection that had to be treated right then. And there was like a definitive before and after. So then all of my health issues after that seemed to be a little bit more subtle. Like I couldn't do like PE with my peers, and I couldn't keep up with the things that they were doing. And that seemed to be more of the fault of my own, of like, oh, well, she's just deconditioned, or she just is not trying hard enough, or isn't interested in being with her peers, that type of thing.
Yeah.
I was definitely aware of like how that made me different from other kids.
Yeah. And I think I would guess that that's probably a pretty common experience for EDS kids, is feeling that difference of like, yeah, my body is not responding to PE and to life in the same way as my peers, and something's making me different, but everyone thinks that I'm just lazy. That's so upsetting.
Yeah.
Yeah. And that's why, I mean, that's one of a million reasons why having a diagnosis is so important. This is something with EDS that I just have a bone to pick with doctors real quick, because this is something that I was checked for along the way in my diagnostic journey. And I heard from multiple doctors, well, if you have EDS, we don't really need to diagnose that. It doesn't matter because there's nothing we can do about it. And I see you're shaking your head. It's such an annoying perspective, and I really don't understand it. If you don't have a diagnosis and there's any diagnosis to be had, you need to have it. Why would you not need to have it? That doesn't make any sense.
Their basis of saying that is that there's technically no treatment or cure for EDS. Okay, fine. You can't cure the defective collagen in the body, but the range of symptoms that appear, you can treat those. You can take medications, you can have surgeries. And then if you're a child or like in school, you need a diagnosis to get accommodations. So what, you just expect me to go to the school and be like, oh, well, I kind of have this thing that can't get a diagnosis for, but I still need accommodations. They're not going to listen to that. They're not going to give you accommodations for that. And just like the understanding of what's going on in your own body, like to have a label for it, because all the labels that were put on me before getting diagnosed with EDS were lazy, deconditioned, out of shape, not wanting to participate, not social with her peer. Like, that is so much worse for my self-esteem and my perspective of myself than knowing you have a genetic condition that affects the way that your body interacts with the rest of the world.
Thank you. Very well said. Couldn't have said it better myself. Such an important thing that, one of those little things that is not a little thing, but one of those many things that we really kind of need to get the word out to doctors about is that is not a helpful perspective. And, for me, EDS was not my diagnosis. But if it was, we would have stopped looking for the other diagnosis because we would have had a diagnosis. So it makes no sense to not even look at a thing. And that's one of those things where I had to go out of pocket and get genetic testing, which is why I'm so excited that, right now we're giving away genetic testing to 3 people. And we have 3 applicants right now that we're looking at. So we're not looking for more applicants at the moment. But I will say that, it's something that I'm just like absolutely thrilled to be doing through the podcast, through our wedding registry with Andy and I. Because, oftentimes doctors will not look under those rocks. And when you are the person living with the thing, you got to look under the rock. And the fact that you can't get help to do that is just absolutely infuriating. Okay. So you're having all these little things happen to you throughout school. You're feeling a little different from your peers. You're being blamed for it your entire childhood, which is so upsetting that I just have to laugh because it just makes me so mad. Otherwise, I'd cry. Yeah. When did you start getting taken seriously by your doctors, and when did you start getting diagnoses?
My first diagnosis was when I was 12. We did like the scoliosis screening at school, and I got flagged. And so they told my mom to take me to the doctor. Pretty sure she took me to Shriners first. They told me that they couldn't help me because my scoliosis was like farther up my back, like between kind of my scapulas. And the hard braces that were the norm at the time couldn't compensate for that type of curve. So we had to go seek out like a special doctor at Seattle, actually. Every 3 months, we had to drive from Idaho to Seattle to see this doctor. He made like a soft brace that was like straps. And so I had to wear these like mesh underwear that had like they were European. They had like a pee hole in the middle of them, right? If I wanted to use it, I never did. And then I wore this like vest that had like 5 different straps, like strapped all around my body. And it was horrible. It was the most uncomfortable thing ever. And my shoulders were constantly dislocating. I was having so much pain and was like crying. And like when I would sleep, I would take this thing off. Like I would wake up in the morning and I wouldn't be wearing it because my body was just like rejecting it. And I would constantly tell this doctor when we'd go, like, I have an x-ray of when my shoulder was dislocated. And he's just like, nah, like, that's just what it is. I'm like 12 with a dislocated shoulder wearing the scoliosis brace. And I had to quit track. I was cutting back on dance. I got cut from volleyball because I couldn't serve the ball without dislocating my shoulders. I tried to do a cartwheel at recess, and both my shoulders like, and I like fell to the ground and hurt myself. And no one cared except my pediatrician, who prescribed me toe touching exercises because I couldn't touch my toes. And so that was super abnormal that I couldn't touch my toes. So then my parents made me do these toe touch stretches at the same time that I had to sit in this traction device. And so I was up against, my dad like makeshift made it. I was up against this board that then had a strap that went around my head. and it would pull my head to this board to basically try and correct my scoliosis. And I had to sit in that for 30 minutes a day and then do my toe touching stretches and wear my scoliosis brace for 20 hours out of the day.
And your body's just screaming, I have EDS, like looking back, it's very obvious and so frustrating that no one noticed. But also, I mean, the awareness of EDS was so much lower, back then, even though it's not that long ago, but we're really just going through a renaissance with EDS awareness in the last 5 years.
Totally.
So I'm so sorry to hear that. So frustrating. And what's your personal experience of this as it's happening? It's like you keep having things happen to you that other you from people your age. And not just that, but it's pulling you away from the things that you love that you want to do. Are you getting frustrated? Are you feeling, why me? Are you starting to get angry at the universe?
Oh, yeah. At this time, I think I was like 14 or 15, sent a very angry email to the doctor that was managing my scoliosis and my brace. And I was like, I can't do this anymore. Like, they were monitoring my growth plates with x-rays to figure out when I could get out of this brace. Because like once your growth plates close, wearing a brace is not very effective anymore. So my last x-ray, my growth plates were almost closed. And I was like, I just need to be done. I can't do this anymore. Like, this is so excruciating. I would just be complaining of such severe pain. And I was like, there's no way this is just from scoliosis. Like, I don't understand what's going on. And I don't even remember how. Eventually, I'm sure he was like, all right, well, you're basically grown, so, you can stop wearing it. And about right after that is when I was diagnosed with POTS. So I didn't really even get a break in between, things going on.
Wow. That's young to be diagnosed with POTS. And also, POTS is a part of this EDS renaissance. So that's actually early to be diagnosed with POTS.
Yes.
What was the process? Did you do a tilt table test?
I did. So it started out in my health class. So I was 15 when I was diagnosed, started out in my health class, and we had to like run in place or something for a minute. And then he was trying to teach us how to like calculate like a heart rate. And so we like checked our pulse for 15 seconds and times it by 4. And when I did that, I got like 220. Like, my pulse was like 220 beats per minute. And he was
my God.
like, you did that wrong. And he made me redo it in front of the whole class. And I redid it and it was the same. And he was like, okay, then something has to be wrong because that's like not right. So they told my parents and they took me to the doctor, like a cardiologist. Or no, my primary first. And then my primary referred me to a cardiologist. And the cardiologist, I'm actually thinking back and like knowing the history of like POTS diagnosis and everything, I'm surprised, but she didn't want to do the tilt table at first. She was just going to give me the diagnosis without the tilt table. And I think I like wanted to do the tilt table to like make sure that was what it was. And it wasn't like something like an actual heart condition, because POTS is like an autonomic condition.
Sure. Yes. But also very, very actual heart condition as well.
Yeah. So did the tilt table, and then she just put me on some beta blockers and was like, that's it. I just saw her literally the one time. She gave me the beta blockers, but the beta blockers didn't really help. And so I was kind of just like not really managing my POTS for a while. This was also when I was going to physical therapy for my really bad joint pain at 15, and they totally thought that was normal. And again, was like not being able to participate in my sports and dance and everything. And I also started complaining of hip pain in that same hip at this time. The same hip that I had sepsis in, however many years ago, was starting to hurt again. And there was like times when I couldn't walk on it. So my mom took me to Shriners again and was like, she had this thing in her hip, but she's not able to walk on it again. And they're like, she's just being dramatic. Keep her in physical therapy. She's fine. Like, wow. No x-rays, no imaging, no nothing. So I just had to deal with these like flare-ups of my hip every once in a while where I couldn't walk, and it would get like red and hot to the touch. And like, if I laid too still for too long, it would really start to hurt. Oh, I was diagnosed with endometriosis in this time as well.
Wow, that's also very young to be diagnosed with endometriosis.
It is, yes.
Oh my God.
It was on my 18th birthday is when I was diagnosed with endo. I had my surgery.
Happy birthday.
Yeah. But I didn't know about the the whole history of endo too, and the different types of surgery. And so I got an ablation instead of an excision. Ablation is where they just burn the endometriosis, and excision is when they take it out. So ablation can actually cause more damage because you're just creating like scar tissue. So I had an ablation and it was diagnosed that way. And that was when I moved to college. I moved out, graduated, moved out to college. Granted, I was still in Idaho, but I had a little bit better access to some care. Diagnosed with endo. My POTS started being managed by outpatient, like once a week IV fluids. And I started trialing more medications than just like the classic beta blocker. I saw an immunologist at this time who detected some thyroid issues, but didn't ever really do anything about those. But the same immunologist was like, wait, you have these random allergic reactions and POTS, and you pass the Baton score or the Baton scale.
Wow.
I think you could have EDS.
Finally.
What's EDS?
Wait, how old are you at this point?
I think I probably just like turned 19.
Okay, and I have MCAS, so obviously these random allergic reactions must be heading towards MCAS because that's like part of the EDS triad.
Yep. So I was getting all these like random allergic reactions, and which I have had my whole life. Kind of forgot to cover that. I went into anaphylaxis the first time when I was 8. I was like on vacation at the Oregon coast, and I went on a horseback ride, and I decided to be allergic to horses, even though I grew up around them, all the years before that. So definitely had like bouts of, allergic reactions growing up too. But again, just thought that was totally normal. So he gave me a referral to the University of Utah, which was like the closest research institution to where I was at the time. And it was a 5-year wait to get into.
Oh my God, no.
Yes. A 5-year wait
What?
to get genesis for an EDS referral.
No.
I basically just got like the clinical, or it's already a clinical diagnosis. I got like an unofficial diagnosis of EDS by the immunologist, and then my primary like went through the criteria too and like unofficially diagnosed me. So I had 2 doctors like backing that diagnosis at 19. I eventually moved from there to now Oregon, which has way better access to quality healthcare, and I had to wait 1 year for a referral to the geneticist in this area. Finally got to see him, and he goes, "Oh yeah, you are classic hypermobile EDS. Don't even need to test you for the other ones. But also I don't like the label or the diagnosis of hypermobile EDS because there's no genetic component. So I'm going to diagnose you with multifactorial EDS, which means that a lot of different things are affecting it. And so you probably have some type of EDS, but because we don't have a genetic component for this type yet, I'm not going to give you that label."
Wow. Okay. So that just made my brain spin around. I've never heard of the term multifactorial EDS.
Well, because it's not real.
Yeah.
Because it's not a subtype. It's not a thing. He made that up.
Wow. And I mean, obviously, if I were you in that case, I'd be like stamping my foot on the ground, screaming, "I need genetic testing."
Yeah. Well, I still was so new to understanding like how to actually go through a diagnosis of EDS. I was like, he just went through the appointment so fast. It just felt like everything was like, going over my head, and I was like, what's going on? And I had waited a year for this appointment, and I ended up messaging like my chart messaging them later and was like, it's weird that he didn't do genetic testing. That's on the criteria to be diagnosed with this. And that was also when I said, I'm trying to get care for EDS. And then when I tell them that my diagnosis is multifactorial EDS, they look at me, one, because they don't even know what EDS is. And then when you go to research that, that's not a thing. And so he saw me again, and I explained all of this again. And he refused to do the genetic testing because I was classic hypermobile. And then he said, fine, I've only given the hypermobile diagnosis out officially to 2 patients, but because you're having such a hard time, like he was just so demeaning about it. Wow. But officially gave me the diagnosis of hypermobile and then discharged me from his care.
Yeah.
So I
Ouch.
sought out genetic testing myself and
Yeah.
paid out of pocket for
Yeah.
it because why, like, one, that's part of the criteria, but two, why would you not want to rule out the other types?
Exactly. Absolutely. I mean, this should be standard practice that anyone who's diagnosed with any form of EDS get the genetic testing.
Any
Because if
form of
you,
connective tissue disorders,
yes,
like
yeah,
even
even
extend
better.
it farther than that. Yeah.
Absolutely. Because there are serious complications that can occur with like vascular EDS, and you need to know if you have it. And if you
Yeah.
don't, then, that tells you definitively, like, well, okay, then we're focusing on the hypermobile form that doesn't have the genetic component. And there's all sorts of really exciting research being done around that right now. I was reading about this, about the connections with EDS and MCAS, and maybe there's no genetic component because there's like some sort of relationship between the two of those that's causative. And this is, I mean, that could be completely wrong. There might be a genetic component we haven't found yet. That's like also a lot of research going into that as well.
Yeah.
And there was research recently of potentially locating a gene that could be involved. So there's like these two avenues of research that are both very exciting that are happening at the same time. I just got on a tangent and forgot why I started talking about that. But anyway.
Why it's so important to do the genetic testing.
Yeah. Yes. Thank you. Exactly.
Yeah.
Okay. So you have the genetic testing done.
Yes, I had the genetic testing done. I sought it out myself and was negative in all of the other subtypes of EDS that actually have a genetic component. So then that solidified that my hypermobile diagnosis was actually accurate.
Yeah.
So that was exciting. That also ruled out, Marfan's or like the other connective tissue disorder types. But I was also going through genetic testing for some other things. So going back to my hip pain that I kept getting, I finally went to an orthopedic surgeon and was like, I am having so much hip pain that I cannot do my daily activities. I can't walk around my house. I can't sleep. I can't lay in bed. Like I can't do anything. And he goes, oh, well, you just need a hip replacement.
Oh my God.
You just need a hip replacement. You had sepsis, septic arthritis. I'm sure it damaged your joint. You just need a hip replacement. And I'm like, a hip replacement at 21 years old. Okay, maybe we should do like an x-ray. And he was like, oh, okay, sure. Did an x-ray. My joint looked fine. He was still going to do the hip replacement, even though my joint looked fine. And I said, no, I need an MRI. Like this, like something is seriously not right about this. I'm not going to just like replace an entire joint at 21. And I had to beg him for the MRI. And he very reluctantly gave it to me. And I'm laying in the MRI machine and I'm like, this is so dumb. I'm wasting everyone's time. I'm wasting my money. Why am I here? They're not going to find anything because they made me feel like I was being so dramatic. Turns out I had a softball-sized tumor in my hip.
Wow.
I've been growing for years and years and years. All the years I've been complaining of pain.
Oh my God.
And it invaded 3 layers of my muscle and was pressing on nerves. And it was flaring up. It was a vascular tumor. So it would flare up and get inflamed. And that's why I would get red and hot and why I couldn't move or walk.
Wow. Can I just say, 21-year-old learning how important it is to advocate for yourself and making this happen is so impressive. And the culmination of a lifetime of being ignored and gaslit and brushed aside for legitimate concerns. I just want to say, go you. That's pretty awesome.
Thank you. Thank you. Yeah. When I moved to Oregon, and that was like around the age that I was 20, 21, that was when everything kind of really took off. So I found out about my hip. That was a big thing. My POTS, like management was finally taken seriously, and they gave me a port to do at-home fluids because my body didn't respond to any of the medications for like treating POTS. Weirdly enough, my body also doesn't respond to any medications to treat depression or like a lot of mental health things. So I actually was diagnosed with treatment-resistant depression, and I had to go through TMS. It's transcranial magnetic stimulation. It's basically when they like shock a specific part of your brain to like stimulate the part of your brain that is asleep that causes depression. So
wow.
I went through that, and my depression is in remission, which is great.
Wow.
But still, like, I'm pretty resistant to like anxiety medications. I've been trying medications to treat OCD, and those just like don't really have any effect on me. So I have that metabolism, medication issue that's common with EDS patients. So I got my port, started doing that. I was having a lot of GI problems that had been slowly getting worse. I was having a lot of pain, fullness, nausea, really bad constipation my whole life, really, really bad constipation. So I was seeing this GI, and he goes, your symptoms sound a lot like a vascular compression called MALS. And I was like, what is that? And so then that opened this whole new door of things. And so vascular compressions are a comorbidity to EDS as well. So I was diagnosed with MALS, median arcuate ligament syndrome. That's when an artery in your abdomen is being compressed and flattened by a ligament. And there's a nerve plexus there. And so it can cause a lot of pain when you eat. Your stomach gets bigger, and then it presses more on this nerve bundle. So I had surgery to take out my hip tumor, and then I had surgery to release that compression in my abdomen. At the same time, I was diagnosed with tethered cord syndrome, which is where your spinal cord gets like stuck in a spot, and you don't have as much flexibility in your spinal cord when you like move, like if you bend over or if you twist, it's more stuck. And so there's a lot more tension. So I was having a constant migraine. I felt like my brain was being pulled out of my skull. I had so much light sensitivity, really bad back pain. And that was why I couldn't touch my toes, was because my spinal cord was stuck and I literally just couldn't move. So all those years I was in the scoliosis brace and they were forcing me to touch my toes, and I was going through the traction. They were actually just putting unnecessary tension on my spinal cord, which was then causing extreme nerve pain throughout my entire body.
Wow.
And that's what I was complaining about when I was 12, 13, 14. And they blamed it on my scoliosis.
Wow. I mean, these are pretty incredible finds. And I'm so glad that, obviously it's awful to have to live through a whole childhood with that, but I'm so glad that you found it this early in life, in your early 20s. I mean, so many people aren't able to find these things ever because doctors aren't willing to listen. So it's like, yeah, it's on one hand, it's awful that it took as long as it did, but on the other hand, it's also something to be grateful for that it happened at all.
Yeah. In relative comparison, I'm lucky because they found it when I was 20, 21, 22, and not when I was 50 or dead. You know, like there's a lot of people that go through their whole lives with these and don't even know.
Yeah, totally. So, yeah. I mean, I was just diagnosed with MCAS when I was 38, and I'm 40 now. You know, I went my whole life without knowing I had this disease. And it was, I had all sorts of weird things happen to me all throughout my life because of it. When you're talking about your random allergic reactions, it was reminding me of when I was a kid. If I got stung by a bee, I would swell up to like a bizarre amount. You know, I got stung on the foot and I was in crutches for weeks because my foot was so large that I like could not walk on it. And everyone's just like, yeah, you just have a weird reaction, and that was just one of many, many things. Like I had to switch classrooms because I got so sick from there being mold in my classroom when I was in second grade. And that happened in high school, and just like flare-ups on and off throughout life. It's just, it's there, it's there the whole time. But nobody knows.
It's not until you look back and you're like, oh.
Yeah.
Okay. Yeah.
Yeah. And your case is one of the most extreme of these that I've heard, where it's like EDS is screaming, pay attention to me your entire life. And all these doctors are ignoring it and blaming you. And it's so frustrating. It happens to so many people.
So many. And a lot of these things are probably more prevalent, but because they're not as well known and doctors don't know what to look for or even how to do the tests correctly, then they're underdiagnosed. So I think I just somehow got kind of lucky with the doctors that I happened to get and knew how to look for the research. Maybe I don't really know. Like, I don't even know. People ask me all the time, like, how did you get a doctor to listen to you, or how did you advocate for this thing? And I wish I had an answer. Like, I think like I had a string of events that happened and I got lucky, honestly. So
I do think, just from hearing what I've heard of your story, it does sound to me like you got good at advocating and you started realizing this is a missing link in my care. I need to bring this to my doctor's attention. And you did. And in some cases, that caused your doctor to terminate care with you because it's like, oh, yeah, I don't want a patient that knows more than me, which is so awful. Like this ridiculous pride that you can sometimes run into with doctors, this ego that no one else can know something. It has to come from me. But you are the person living with the thing, and you are the body that's being affected by it, and it's your life. So of course you want to like look into it. And when he diagnoses you with a non-existent form of EDS, of course you want to complain about that because it affects your life in every other way when you go to other doctors. So yeah, I can really hear your skill in advocating growing throughout the course of this story and getting to a point where you're moving things by the time you're 20, 21, 22, which is awesome.
I was like, come on, we got to get this done. Because I got my port placed December 2022. I had my hip surgery February of 23, tether cord surgery April of 23, MALS surgery August of 23. And then I was diagnosed with MCAS in the middle, like an official diagnosis of MCAS through all of that at the same time. I was diagnosed with other vascular compressions at the same time, SMAS, Nutcracker, May-Thurner. I haven't had like surgery for any of those. I just did the MALS. But then I was like, after the MALS, I was like, okay, I get a second to not have a surgery for a minute. And then that, you know, the hip tumor and like the sepsis, those are kind of like one-off, more like less associated with EDS, more one-offs. And so then I started having these other one-off things. I grew like some bone spurs in my nose. And I had a super deviated septum, which was trapping a bunch of, I don't even know what you would call it. Just trapping a bunch of stuff in my sinuses and my nose, which was making my MCAS symptoms worse. So I was having more of these MCAS reactions. So then I had to have surgery to fix my nose, which has been super great. And around the same time, I found a lump in my breast and had to go to the doctor for that. That was super invalidating. You know, everybody was like, it's nothing. It's not gonna be anything. They thought it was a lymph node, just an inflamed lymph node from accessing my port. That's what he tried to blame it on. No, it was an actual tumor that was there. But the biopsy came back benign, but it couldn't determine whether it was something that was benign that would stay benign or something that was benign now that could not be benign in the future. So I had a lumpectomy to remove that. And then I started going through the intense testing for my lower GI symptoms that were happening. So I've been constipated severely my entire life. It kind of just became this joke that Tayler doesn't poop. Tayler poops once a month type of thing. Which, I mean, okay, yeah, we can make light of it, but it was really awful. It caused a lot of pain and symptoms that I didn't even realize were that bad until after I got it addressed. But finally, I failed all of the testing for that, and I got referred to a colorectal surgeon. And at my first appointment, she goes, "You're going to need a permanent ileostomy bag." And I was like, "Whoa, girl, hold on a second. This is our first time meeting. Like, take me out to dinner first." You know what I mean? No, but she was really great. But yeah, so then from there, I went through all of this testing. I mean, super invasive in the sense of like your dignity. Like they were putting stuff up my butt and they were like making me poop stuff out. Like they were doing a lot of things to a lot of places. Wow. And then I made the decision to go ahead with my permanent ileostomy bag. I found out in the process of all this that EDS was affecting. So it's common knowledge that EDS can cause pelvic organ prolapses, like more specifically in women. So like bladder, uterus, rectum, anal type prolapses. But there's something called visceroptosis, which is way less known. And that is a prolapsing of abdominal organs like stomach, small intestine, and large intestine. So my stomach, small intestine, large intestine are all prolapsed from where they're supposed to be into my pelvis. So my stomach, like instead of being up here, is like down past my hip bones.
Wow.
And so that all of my GI tract was basically collapsing on itself, which was contributing to the constipation issues. So I was having like outlet problems, like things weren't able to come out because of the, collapsing, but also my large intestine was just paralyzed too at the same time. So I got my permanent ileostomy. I'm 6 months post-op now from that. And this is, I don't know how much of this stuff is too TMI, but I was having a really hard time.
Nothing. There is no such thing as TMI on major pain. Okay,
good. Well, prepare yourself. So I was having a really hard time kind of most people when they get ostomies, they're getting it for IBD, Crohn's, ulcerative colitis, stuff like that. It's way less common to get it for my type of issue. So I was kind of having a hard time allowing myself to feel like it was a valid reason to be getting an ostomy bag.
Hmm.
You know, because it's not something, you know, you could get a bowel obstruction and that could be life-threatening, but I wasn't actively getting like abscesses or infections that some other people do. But now since having my ostomy, they didn't clear me out. I did like the bowel prep. I did the intense bowel prep that you're supposed to do. And, you know, I showed up to my surgery and I'm like, guys, I drank all this stuff. I took all the pills and nothing has come out. And they're like,
Oh my God.
it's fine. They're like, that's why you're getting surgery.
I just have to pause for 1 second because I've done a colonoscopy and I've done that prep, and that is horrifying that nothing would come out because, like, you know, for everyone else, everything comes out.
Everything comes out.
You know,
it's
you're
meant to clear you out. Yeah,
you're in for a wild couple of days, people. So that's terrifying because, like, what's happening? You know,
I was so stressed. I thought they were going to cancel my surgery because I was like, you know, you're supposed to kind of clear this out. And so I showed up and I'm like, guys, I literally nothing has come out. And they're like, well, that's why you're getting surgery, basically. And I was like, are you going to clear me out like from the bottom? And they're like, no, we'll just like let it come out after surgery. Well, they didn't really tell me that. I found that out after the fact because I got the surgery, didn't realize that they didn't clear me out. And I felt like I had to poop out of my butt when I was in the hospital. And so I like went and sat down and I did. And I called the nurse and I was like, I just pooped out of my butt. She wasn't my normal nurse. And she was like, and I was like, oh, I'm here because I'm not supposed to be doing this anymore. And she like explained to me like, that's can happen for a few days. She said a few days after surgery. Okay. I'm a little over 6 months post-op. I just pooped out my butt the other day. I still have stool in my colon that has not come out yet because my colon is that broken.
Wow.
Yeah.
I mean, it's terrifying that doctors aren't taking that seriously.
Yeah. It's seen as not as so many people message me and are like, I am in the same exact position as you. I don't have a bowel movement for a month at a time and no one will take it seriously. They just tell me to eat more fiber. And I don't know why they don't take it seriously. Like it's really not just constipation. Like when I tell people, oh, I got, you know, an ostomy because I was constipated, like it's not taken seriously at all. And I wish there was like a different way. I mean, I could explain, you know, my bowels prolapsed and it was collapsed on itself and it's paralyzed and broken. But like, I don't know. It feels there needs to be some sort of better way to explain it to doctors to be taken more seriously because I'm glad that my surgeon took it seriously. She said that she has barely done any ostomies for people in my case. I was one of, you know, a handful that she had done so far. Coincidentally, she did somebody else who has EDS who lives 30 minutes from me on the same day for the same reason. And we were in the hospital at the same time. And now we know each other and we're friends. But yeah, I guess I got lucky, but there's a lot of people that message me and they're like, no one will take this seriously. They get blockages, bowel obstructions. They have to go, you know, get them surgically cleared out. It's horrible.
Yeah. I mean, and at the same time, you're going through this massive life transition where you now have an ostomy bag and the way that you process food, a basic human function is, you know, completely altered.
Yeah.
While you still are having some remnants of the, you know, you still are pooping out your butt sometimes.
Yeah. I'm like, I was supposed to it's so painful to poop out my butt. Like just like the pelvic dysfunction that I have down there. It's so incredibly painful. And over the past 6 months, I haven't had to use those muscles. So then every once in a while when it comes up, I'm like, oh my gosh, like it reminds me like I made the right choice. Like this is miserable. I didn't realize till I was on the other side of it how bad and how miserable I was, really.
Yeah. So anything new that you're eating, I'm hoping is clearing through the ostomy bag, and what's coming out the other side is old. Something
it's
that's
old. Yes.
There's at least
no
6 months old.
Yeah. There's no connection between my small bowel, like where it's coming out. There's an end ileostomy and a loop ileostomy. I have an end where there's no connection. A loop, there is kind of a connection, and that could possibly be happening where it's kind of making its way through. But mine is completely cut, severed, it's an end. So everything that's coming out is from before surgery over 6 months ago.
Wow. And is the ostomy bag working correctly? Things are passing through that way the way you want them to. And
Yes.
okay, so what's that been like making that change?
It honestly, I think I had a lot easier transition than a lot of other people do, which I'm super grateful for. I think I was just so miserable that once I realized how much this is helping me, I had a lot better time adjusting. But I also had the community already to reach out to people to help put my mind at ease and know that it's going to be okay. Like I had already had this, great community in the chronic illness, corner of the world and of the internet. And so finding people who were going through similar things wasn't easy, but I still had the resources to be able to do that. And so talking to people and hearing their stories and hearing how much it's helped them and how they adjusted and got used to the idea was super, super helpful. I kind of came up with this like game plan because it wasn't an emergency surgery. I was able to wear a bag on my body like before my surgery to get used to feeling it and seeing how I looked with it and everything. I started to make the ostomy bag covers and was able to have some of those to take to the hospital. I had them for my surgery, which was super helpful. And just like doing research and talking to my surgeon and the stoma nurse about what to expect. So I've gotten really lucky in the sense that I've had an easy transition, but also my ostomy is working exactly how it should be. I haven't had any issues with it whatsoever. Like it all went really, really well.
Yeah, so cool. And I love this idea of turning it into a creative project, making these ostomy bag covers.
Yes.
What is the process of that, and where can people find them?
I make them all by hand. So I'm on Etsy right now. I hope to eventually have a different platform, but it's all me. I thrift actually or secondhand all the fabric because
Cool.
the thing that a lot of ostomates say is that their ostomy bag gave them a second chance at life. So I loved applying that idea to the fabric that I'm using for the covers, like taking the secondhand fabric that, people don't like donated, they didn't want anymore, and making covers out of those. But it also makes each cover unique, which is super fun because then when people are buying them, they know that there's only a handful. Once I run out of that fabric, I can't get it again because I, got it at this random thrift store in the middle of nowhere. So that's super
Very
fun.
cool.
I handmade all of them. So lots of love goes into all of them. It's hard not to keep one for myself every single time. But yeah, it's fun.
Wow. So, I mean, you've had such an amazing journey so far. You've been through a ton to be in your mid-20s. But in the midst of all that, you've told us in the beginning that you married your high school sweetheart. So you also have this love story that's in parallel with your health journey. How have those two things interacted?
He has been great. We were just so serious from the start of us dating, like 16, 17. Like our parents always said that like they knew we were going to get married because we've always been so serious. He's always been so understanding, helpful, accommodating. We've tried to like I want to do like some sort of interview with both of us to be like, because we get so many questions about our interabled marriage and relationship. And a lot of the questions are like, how did he adjust to you being chronically ill? But he never knew any different. Like, that's just how I've always been, And because we started dating so early, like he didn't really date anyone else before that. Like he's never had an able-bodied girlfriend, basically. So it's kind of hard to compare it in that sense. But we just learn as we go, and it takes a lot of communication. And I think what is super special is that since we were high school sweethearts, we grew together. And that I think made us and our relationship and our marriage stronger is like we're actively choosing to grow together and like learn together and be better people every day together rather than growing apart,
Yeah, that's beautiful. I love that. And, I have a lot of experience in similar ways with my wife. I was very, very sick for the first 6 years of our relationship. And then 2 years after that, sort of in recovery as I finally got a diagnosis and medication. And now I'm doing great. And we're in this weird spot where she's never been with a an active, healthy version of me,
Right.
you know, and that's an adjustment. And
Right.
there's all this anxiety around relapse and, you know, things that we're dealing with, which, you know, couples therapy is fantastic. And we've been doing that for years and I highly recommend it.
We did
But
it
yeah,
too. We did
yeah.
it too. And especially, I mean, a lot of people they like to tiptoe around talking about chronic illness and intimacy too.
Mm-hmm.
And so when we did couples therapy, it was also intimacy, sex therapy at the same time, because that's a huge part of a relationship, but that's also a huge part of chronic illness and like how those two things intersect too. So I also highly recommend couples therapy if
Yeah.
you're like, I think it's great for all couples, even if you're doing great.
Yeah, absolutely. I mean, for us, it sounds like it might have been similar for you. It's kind of like you're in a throuple. It's like you, your partner, and the illness, you know? And you have to learn how to get along with each other because you are all intertwined together in ways that you wouldn't necessarily be able to predict. So yeah, super, super important.
Exactly.
What an incredible story. Is there anything about your story that we haven't covered yet today? I mean, I'm sure there's a lot, but
sure there is. I'm sure there is.
Yeah.
A lot of learning, a lot of self-advocacy. I didn't really touch on hearing loss. I do have hearing loss from EDS too. And so that has been integral in self-advocacy as well, advocating for access to accommodations like captioning, interpreters, just stuff like that. And that is kind of what also inspired now what I do as an interpreter, like what I got my degree for. So that all tied in as well. If I didn't have EDS, I wouldn't have hearing loss, and then I wouldn't be, have the degree and do what I do now. So a lot of advocacy in that area, and that's kind of where I started. Like the communal type advocacy was through ASL and the deaf community. And so that has been like a huge identifier too. And having this kind of like niche group of deaf disabled people. So that is like an identity. It's like capital D deaf and then capital D disabled as one word. So I have like this like cool area of audience where there's people that fall into that core category. And maybe this is where I drop this, but I'm partnering with another deaf disabled kind of group, and we're starting a support group specifically for deaf disabled people online.
Awesome.
We haven't announced it yet, so that's my announcement, I guess.
Yeah. Where do people find it?
I'll post about it on my Instagram.
Awesome.
And TikTok is where it'll be, but I'm partnering with her tag is for the deaf girl. Yeah. So partnering with her, that'll be super fun. But that's like a cool little niche that, that doesn't always, the history of deaf community is so deep, but there's a real issue with lack of access to information and lack of access to support networks because of like the accessibility, factors included in that. So it'll be really great to have something specific for this group, because a lot of support groups aren't accessible to deaf people. So if you're deaf and you have disability or chronic illness, going to random support group that you found online might not be accessible, likely isn't accessible for them. So I'm super excited about that too.
Yeah, amazing. Wow. Well, I have one more question for you. So if you could hop in a time machine and go back to the beginning of this journey and meet yourself, I guess you'd be 4, Yeah.
Yeah.
If you could talk to 4-year-old Tayler, given all the experience that you've had and keeping in mind other young people out there who are going through similar things, what are the words of wisdom or words of advice that you would bring from the future?
Honestly, if I was talking to myself, I would just give encouragement to do what you're going to do. Like, I don't think changing any part of my story, I don't necessarily want that, because I think that everything that I had to go through and everything that I had to learn was for a reason. I don't think if I had it easier in not having to self advocate, then I wouldn't be advocating online and for other people. Like what I had to go through inspired what I'm doing now. And so maybe just like encouragement to keep going in that. But I don't think I would really change my experience, even though it was horrible to go through. who wants to really go through these invalidating type experiences? But it put me where I am now. If I were to say it to other people, I would say self-advocacy is going to be your biggest best friend, and you know what is going on in your body. Like, trust your body. You know what's going on in your body. Advocate for what you think is wrong. It's okay to get second opinions. It's okay to go find a different doctor. What a doctor tells you is not end all be all, and you have autonomy over your own body.
Amazing. Tayler, you have done an incredible job today. What a joy of an episode. It's been so fun hearing your story, and also just really impactful. You've been through so much. There's so much to take away from this and learn from this for other people going through anything similar. And I'm sure that people listening are going to want to connect with you online. Maybe check out your ostomy bags on Etsy or your personal advocacy that you're doing on social media. So tell us where we can go to connect with you.
So I'm on TikTok, Instagram, and Blue Sky. My username is at Distabbled, DISTAAYBLED. And then my bag cover has an Instagram. It's Omi, OMY Bags Official. And on Etsy, it's Omi #2 bags, but #2 is like NO #2. And yeah, that's where I hang out, and that's where I love to connect with the community. And I'm just like building so many connections. And if you're in the Portland, Pacific Northwest area, there's lots of in-person meetups that we do. We try to do them quarterly. So always reach out. I'm like always so down to meet up with people and actually like start to form a community in face-to-face life too. So
amazing. Well, thank you so much for coming on the show. I'm just thrilled to be able to share your story and to be able to connect with you and talk with you today. It's been so much fun. Just really appreciate you doing this.
No, thank you for having me. This was great. And thank you for providing the platform to share my story. I don't know the last time I've actually shared it from start to end like that. So thank you.
My pleasure. Thanks for listening to this episode of Major Pain. I'm Jesse Mercury, your host and the producer of this podcast. Artwork by Egg Salad Salad. Our theme music is the song Time Machine from my synth-pop album Sci-Fi, now streaming everywhere. Support this show on social media, TikTok, Instagram, YouTube, and Facebook, all at Major Pain Podcast. If you have questions or comments you'd like to share with myself, our guests, or our listeners, send an email to majorpainpodcast@gmail.com. You can also visit our website to learn more about this show, support its creation, or comment on any episode at majorpainpodcast.com. Major Pain is supported by our listeners on Patreon. Thank you to our $2 per month supporters, our $7 per month patrons Naomi Adele Smith, Sonny Roberts, Kelsey Matson, Alexandria Henderson, Justin Minnick, Laura Stevens, Heather Muncie, and Robert, and our $25 per month producers Steve Kavanaugh, Chris Fowler, Trish O'Brien, and Hipster Leia. Learn how you can support this podcast while receiving special recognition on the show, gifts, and monthly bonus episodes at patreon.com/majorpainpodcasts.